Okay, welcome everybody to our re-recording of our first learning session on Focus Area 1, the Pediatric Emergency Care Coordinator or Pediatric Champion. Originally aired on September 16th, 2021. However, due to the technical difficulties that we experienced, we are re-recording this for sound clarity and fluidity. So with that, I will jump right in. We need to start with our acknowledgement and disclaimer. So the Emergency Medical Services for Children Innovation and Improvement Center is supported by the Health Resources and Services Administration, HRSA, of the U.S. Department of Health and Human Services as part of an award with 0% finance from non-governmental sources. The content here are those of the authors and does not necessarily represent the official views of nor an endorsement by HRSA, HHS, or the U.S. government. So for more information, please visit HRSA.gov. A recording of this session, this recording will be posted to the participants only section of the website at the following link. Quick disclosure to learners as required by our CE accrediting agencies. Criteria for successful completion in order to gain your contact hours is you must attend the live session and complete and submit an evaluation afterwards. These should be emailed to you approximately the Friday following each learning session. Please email me at pwdc@emscimprovement.center if you don't get the link to your evaluation. And most importantly, the planners and presenters of this course have no conflicts of interest to disclose. So with that, I want to introduce today's speakers. Rachel Alter is co-lead for the National Prehospital Pediatric Readiness Project, as well as the EIC State Partnership in Prehospital Domains. And if that wasn't enough, Rachel is also a program manager with the National Association of State EMS Officials, and serves as a staff liaison to the Pediatric Emergency Care Council. Rachel comes with a pretty extensive background in pre-hospital. Also have Michelle Megling. She's a project manager with the EIC, serving in both a disaster domain and hospital domains. A nurse by background, Michelle also serves as a coordinator for community pediatric emergency services at Rainbow Babies and Children's Hospital in Cleveland, Ohio. So quick agenda for today's session. We'll give a quick overview of the focus area. What is a PECC? How do you define a PECC? What are common roles and responsibilities and types of individuals that fill this role, as well as key drivers on how to be most effective in this role and how to really implement this role within your agency or your ED. And then we'll walk through how to begin improving here. So we'll take you through our process flow map, the environmental scan, and we'll talk a little bit about measurement and how you can measure your improvement efforts and how you really improve the role. Quick dip into aim statements and building a team, and then you will hear from me again with some housekeeping and reminder items. So with that, I will turn it over to Rachel and Michelle.
Okay, welcome everybody. Our purpose statement is Pediatric Emergency Care Coordinator. Today's presentation is really going to explore the roles, responsibilities, and skill set of an effective PECC and identify strategies that you can use to create and strengthen that role within either your EMS agency, emergency department, or hospital. Next slide, please.
All right, so we're going to just move into the overview and history of the PECC role, just to provide a brief bit of level setting on where we've come from and where we're going with this concept. So since 1983, the Los Angeles Emergency Department's Approved for Pediatrics, or EDAP program, has required that these EDs have a pediatric liaison nurse on staff. Increased focus on the importance of the role is commonly attributed to the 2006 Institute of Medicine report, Emergency Care for Children with Growing Pains, and I'm sure many of you have seen this report. So this report noted significant inadequacies in the nation's emergency care system's capacity to manage ill or injured children, and called for both hospitals and EMS agencies to identify qualified coordinators of pediatric emergency care. So in line with the Growing Pains report, the Health Resources and Services Administration Emergency Medical Services for Children program established a performance measure for their state partnership program grantees that by 2026, 90% of all EMS agencies will have a pediatric emergency care coordinator. And lastly, both the joint policy statement, pediatric readiness in emergency departments, and the technical report, pediatric readiness and emergency medical services systems, support the recommendations from this IOM report. So what is a PECC? PECC is an emergency care coordinator, ultimately responsible for coordinating pediatric specific activities in your emergency department, hospital, or EMS agency. And so just really quickly, we're going to show a brief video showing the integration of an EMS PECC through the emergency department.
Girl is reported to be shaking uncontrollably. The arriving ambulance has a PECC who is also the education coordinator and has been in the PECC role for the last year. In each ambulance, there is an additional pediatric specific jump kit, and agency staff have recently been trained on its contents. The EMS practitioners arrive to find the mom with the convulsing baby. The paramedic approaches the visibly upset mom, and keeping the child and mom together provides the mom an opportunity to explain that the baby has been unwell with a fever since yesterday. Because the baby still had a fever this morning, mom gave her some Tylenol with breakfast. Meanwhile, the EMT observes an older sibling, approximately 5 years old, quietly watching but obviously worried from the doorway. He walks over and introduces himself to the child and remains with him to explain everything his partner is doing. Using both a length-based tape and dosing guide, the paramedic measures the baby and provides the appropriate amount of Ativan to stop the seizing. Once the baby is stable, she is transported to the closest hospital, which is a general hospital whose emergency department has also initiated a PECC pediatric readiness program. The paramedic radios in a standardized report prior to arrival that includes brief history, weight, vital signs, blood sugar assessment, and medications administered. On arrival, the paramedic provides a warm handoff to confirm accurate sharing of information. An initial triage assessment is conducted using a validated pediatric triage tool, including measuring the child's weight in kilograms only and asking pediatric-specific questions such as immunization schedule and allergies. Since the baby arrived at the hospital with a fever, the triage nurse knows he can use a standing physician order to administer antipyretics. However, knowing the child already received Tylenol, ibuprofen is administered using a pre-calculated dosing guide based on the child's weight. Having just completed his annual pediatric competency training, the nurse knows where to find the pediatric-specific medications and supplies, to include pediatric-sized syringes, blood pressure cuffs, straight catheter kits, child-friendly Band-Aids, and stickers. While in the ED, mom is encouraged to both stay with the baby and participate in her care, including comforting the baby while the nurse inserts a urine catheter. The parent is further coached on how to assist with the holding technique and talking to the child to help distract from the procedure. The baby was diagnosed with a febrile seizure secondary to a UTI and discharged home with a prescription for antibiotics. Mom was provided teaching on accurate acetaminophen dosing, as well as some helpful strategies to administer medication. The mother and baby left the emergency department with no fluid.
All right, so if you are rewatching this recording, something to think about if you just wanted to pause your video for a little bit. Do you think the care for this family was improved because of the presence of both a pre-hospital and hospital PECC? And would this scenario have gone differently at your EMS agency or emergency department? And as you think about that, why would it have gone differently? Is it because you don't have a PECC or not the resources, or in what way may that have been different? Next slide, please. Let's dive in really quick to roles and responsibilities of the pediatric emergency care coordinator. Next slide. So who can fill this role? When we're thinking about, I'm sorry, can you expand on? Thanks. Okay, so this role can be filled by a nurse within the ED, physician assistant, a physician, a pharmacist, EMT, paramedic, really anybody who has a passion for kids can fill this role. The nurse can be a pediatric emergency board certified in pediatric emergency medicine, but that doesn't necessarily have to be. And individuals don't have to be solely dedicated to this role, although they could be. This could be a single individual working within the single agency or hospital, or a shared role among multiple individuals within the agency or hospital. It could be a single, I am so sorry, you guys. I don't know what's just happened. Can we start this slide over? Okay, so who can fill this role? The individual filling this role does not have to have a pediatric specialty training. They can be an EMT or paramedic, registered nurse or advanced practice nurse, a physician assistant or physician, or anything in between. The physician PECC could be board certified or eligible in emergency medicine or pediatric emergency medicine. And the nurse PECC could be board certified in emergency nursing or pediatric emergency nursing, but these certifications are not required. Individuals don't have to be dedicated solely to this role, although they could be, recognizing that every ED and EMS agency will have varying levels of staffing resources. The structure could be a single individual working within a single agency or hospital, a shared role among multiple individuals within a single agency or hospital, or a single individual shared by multiple agencies or hospitals, considering maybe a region or hospital network. So ultimately, you simply need to have a passion to provide the best possible care to children. Next slide. All right, so in thinking about the roles and responsibilities of the pre-hospital PECC, this role could include ensuring that pediatric perspective is included in the development and maintenance of protocols, could be supporting providers' use of pediatric protocols and guidelines. You could promote pediatric continuing education opportunities, oversee pediatric process improvement initiatives, ensure the availability of pediatric specific equipment, supplies, and medications, promote agency participation in pediatric injury prevention programs, liaise with the local emergency department PECC, and promote family-centered care at your agency. And I don't want you to look at this list and think it's completely overwhelming and there's no way you could do all of those things. We're gonna reiterate through this whole process that we want you to start small. Think of what's the easiest thing you could do to start with. So maybe that is just ensuring the availability of those equipment, supplies, and medications, and move up to the quality improvement part of this role. So in thinking about these roles, some of the key points that were demonstrated in the video scenario we showed earlier, the team arrived with a pediatric specific jump bag. They kept the child and caregiver together, and they interacted with the sibling, employing family-centered care. And then the paramedic did utilize a length-based tape to estimate weight, and the pediatric protocols included the drug dosing references. Next slide.
Okay, now we're going to talk about the roles and responsibilities of the physician or advanced practice provider. The hospital PECC, and if available, the physician PECC, should work concurrently at improving comfort in caring for pediatric patients and focus on improving the quality of care for the pediatric population. So what type of activities could a PECC, whether it be a physician or advanced practice provider, participate in? The emergency department provider PECC can help with promoting and verifying adequate skills of the ED healthcare providers in the emergency care and resuscitation of infants and children. They can participate in ED quality improvement, practice improvement, patient safety, injury and illness prevention, and clinical care activities. They can assist with development and periodic review of ED policies, procedures, and standards for medication, equipment, and supplies to ensure adequate resources for children of all ages. When we look at the scenario, they did have pediatric evidence-based protocols. They used weight-based dosing. So just assuring, if you just want to take one or two things out of this to start with, is make sure that you have weight-based dosing available in your order sets, or if you're not in electronic medical record, that you have a way of doing that as well. And making sure that all of your protocols are evidence-based and pediatric specific. Next slide, please. When talking about the roles and responsibility of the nurse or other healthcare provider, Like Rachel had mentioned, a PEC doesn't have to be a nurse. It can be a pharmacist, it can be a respiratory therapist, it can be a paramedic in the emergency department. We really want them to facilitate and participate in ED, pediatric quality improvement and process improvement, collaborate to ensure that competency evaluations are completed by the ED nursing staff and are pertinent to children of all ages, promote pediatric disaster preparedness for the ED, and then as you grow in the PEC role, participating in hospital disaster preparedness activities, making sure the hospital is prepared if pediatric patients present, promoting patient and family education in illness and injury prevention, and then working with clinical leadership to ensure the availability of pediatric equipment, medication, making sure you have appropriate staffing and other resources through the development and periodic review of ED standards, policies, and procedures. Collaborate with physician coordinator to ensure that the ED is prepared to care for children of all ages. And we look at our scenario, utilizing an evidence-based validated triage tool, pediatric protocols, and then really continuing the family-centered care of keeping the patient and family together, even through procedures. And when we talk about hospital PEC collaboration between the provider and the nurse or hospital PEC, it's really promoting skills and knowledge in the care and resuscitation of infants and children, really having input into how their respective disciplines demonstrate competency, making sure that weights are in kilos, medication dosing, equipment appropriate for infant and children, and making sure pediatrics is included in your disaster plan. Also facilitating education for in and out of hospital, so even including your pre-hospital providers and some of that education and offering that to them as well. Next slide. So I know you guys have seen this before, our PEC Workforce Development Collaborative. As we look at the role of the PEC, there is a large focus on everyday pediatric readiness. As you go through the pediatric workforce development, every month the focus will be on a key concept of the PEC. When you think about patient safety, looking at the unique needs of pediatric patients and making sure there's an inclusion of families, policies and procedures that include children and also include children with special healthcare needs, making sure you have a quality improvement process, looking at your outcomes and looking to improve those outcomes. Communicating and collaborating, being that pediatric liaison and collaborating with the experts, using competencies to assure that they start at orientation and are reviewed at certain intervals and continue throughout people's workforce. Looking at your equipment, supplies, and medication, do you have the appropriate size equipment that fits pediatric patients from a potential delivery that could end up in your ER up to adulthood? Next slide, please.
So we know that pediatric patients often provoke discomfort and anxiety among healthcare personnel, but we also need to remember that the child you're seeing probably doesn't want to be in this situation either. So recognizing this helps us understand the value of the PEC role. Next slide. So in the United States, most children who seek emergency care present in general EDs versus specialized pediatric EDs. And the Institute of Medicine has identified that these children are often seen in EDs that were not well prepared to care for them, both in terms of availability of equipment and supplies, as well as training and readiness of the ED staff. So analysis of National Pediatric Readiness Project assessment data has found that EDs with a designated PEC were more ready than those who did not have a PEC identified. So we know that the presence of both the nurse and physician PEC is strongly correlated with improved pediatric readiness, independent of other factors. And if you could click next real quick, Meredith. So we do know that this increased readiness scores are associated with decreased mortality. Next slide. So in thinking about the value of the PEC role in the pre-hospital environment, EMS responses for pediatric patients represent less than 10% of total EMS responses in the US, but because call volume is highly variable, 43% of all EMS agencies in the US see fewer than 13 pediatric patients a year. So why do these numbers matter? The pediatric training requirements for EMS provider licensure and relicensure vary from 4 to 9 hours for EMTs and 7 to 34 hours for paramedics. And these pediatric requirements are often combined into a special populations category. So the infrequency of seeing pediatric patients in the field means that pediatric care does not become hardwired into those providers' muscle memory. And because many EMS agencies have limited chance to exercise their pediatric skills in real life settings, the responding providers may not feel confident in providing that care, the appropriate care. So having this individual overseeing pediatric specific activities can help by serving as a pediatric resource within that agency, helping to alleviate some of these challenges. Next slide. So in thinking about why this role matters, we combine all of these concepts and so that having that individual in the ED or EMS agency coordinating emergency care has far-reaching benefits. It can increase staff confidence, can provide additional training opportunities because you have somebody who's really looking for any external training opportunities or even internal training opportunities. And having these things helps improve the care of a pediatric patient. And also having somebody in this role ensures that the pediatric interests are represented throughout your organization. So having a designated PECC can assure the highest quality of emergency care for all children by increasing staff knowledge, skills, and competence. Next slide. So in summary, benefits of having a PECC are identifying gaps and ensuring resources to care for children are available. You can maintain a relationship with state or territory EMS or children infrastructure. You can work with state and local authorities and regional coalitions to develop strategies for addressing pediatric needs in the event of a disaster. You can establish and maintain offline and online pediatric protocols, establish QI plans with pediatric specific indicators, reviewing on a regular basis medications, equipment, and supplies available for the care of children. Liaison between hospitals and EMS agencies can improve pediatric readiness in your community, and it assists with the education and training of staff and the principles of family-centered care. Next slide.
Okay, now we are going to talk about key drivers. You may ask, what are key drivers? Key drivers are areas or concepts which will contribute to the success of your goal. The goal or purpose statement of this focus area is to create or strengthen the role of a PECC. These are the key drivers are the what's. Next slide, please. So when we look at our key drivers, our first one is advocacy and communication. So identifying our experts, garner input from your team, and really raising awareness. Why is having a PECC important, and how to teach everyone why it's important. So really being able to identify that. Next slide, please. So with advocacy and communication, it's really doing an environmental scan of your agency or ED. And some things to think about or look at is, what is your pediatric volume? Are you seeing 5 kids a day, or are you seeing 1 kid a day? What illnesses do most often see in children? Are they respiratory or asthma? Do you have a large population or even just a few children and youth with special healthcare needs? Do you see a lot of pediatric traumas? And what is your team's comfort level when treating these pediatric patients? How do you gain support by reaching out to families and at family advisory networks, utilizing external resources such as EMSC state partnership programs? Do you have local children's hospital or regional children's hospital that can help you? And even state chapters of key partners such as AAP, ENA, ACEP, ACS, and NSMSCO. Think about what's your own entity. What kind of kids do you see in the community? If you have complex kids in your community or children and youth with special healthcare needs, do you stress out when you get a call or they arrive to your ED? Do you have a plan for them? Or how can you help them coordinate a plan with the family and their medical team? Next slide, please. So key driver number 2 is really education for you as the PECC. How do you identify your own needs, or where do you have gaps? Identify what training opportunities you think would be helpful. Identifying education and advocating for that PECC, that the PECC gets extra education on pediatric care. What specific training do you as the PECC need or feel that you need? Are you comfortable caring for children of all ages. Next slide, please. And thinking about education, really identifying what are your strengths, what are your weaknesses, what are your top priorities or opportunities, and what do you worry about most? Is it a potential code or life-threatening situation, or is it any pediatric infant or child that comes into your ED, knowing even where to find equipment? Really keeping and remaining the focus being on the PEC role. This may not even be clinical skills that you need. It may be leadership skills to help you roll some of this information out and be supportive. It may be quality improvement skills. Understanding key components of pediatric readiness. Is your ED pediatric ready? How do you figure this out? Did your manager complete the recent pediatric readiness assessment? Were you able to help with that? Take a look at those results and see where do you have opportunities in your ED. This is the first educational program designed specifically for PECs. This is your first step. How do you garner additional pediatric knowledge? At the end of this, you should be able to go back to your hospital team or EMS agency and be recognized that you have this education and you're able to accomplish creating or solidifying that PEC role. Next slide, please.
All right, so our key driver 3 is about process and policies, and this isn't policies as a whole in your EMS agency or ED, but just those that relate to the pediatric emergency care coordinator role. So we're going to quickly look at key responsibilities, job descriptions, and protected time. Next slide. All right, so what should the PEC's key responsibilities be at your agency or hospital? This really could look very differently depending on where you're at, whether it be in an urban or rural setting, staffing issues, etc. Once you determine what these roles should be, verify that they're included in your job description or use this as a foundation for creating a job description. And you don't have to have a standalone job description for this, like we just discussed in a previous slide. This could be a role that's shared by some people. It could just be another hat that you're wearing already. You could be the training coordinator at your EMS agency and just taking on these duties of a PEC as well. So are these roles and responsibilities included in your additional in your current job description? So give this role an appropriate title that fits within your organization structure and culture. Not all organizations use the title of a pediatric emergency care coordinator, but instead use pediatric champion, and that may fit better within the culture of your organization. So having this title really does give you the clout to take action, impact the care of the children in your community. And also, have you been provided protected time to perform these duties, and how can you make sure that there is space for these responsibilities? Next slide. All right, so our last key driver is about resources. We're going to talk quickly about time, budget, stakeholder support, and external tools. So what are these resources and what do you need to make you an effective PEC within your organization? So in thinking about time, can you advocate for a full-time position? If not, ensure that you have protected time to focus on pediatric related duties during your shifts. What does this look like in your organization, and how many hours should this be to remain effective in your role? So in thinking about a budget, develop a budget justification to advocate for funding to be spent on materials that support your role. This could be training materials or travel to training opportunities, equipment, or supplies. Stakeholder support, identify agency or stakeholder, institutional stakeholders that will support the work of the PEC. Are there statewide or regional pediatric committees you can participate in? For EMS agencies, is there a local air ambulance that could help support you with education opportunities? Or for emergency departments, is there a children's hospital nearby that could also support you with educational opportunities? Have you connected with your state EMS or Children's State Partnership Program Manager? They may have training opportunities or equipment for checkout. For external tools, don't reinvent the wheel. Research what resources are already out there. Again, your state or territory state partnership program manager could be your best friend in this regard. And the National Pediatric Readiness Project and the Prehospital Pediatric Readiness Project both have created checklists and toolkits for EDs and EMS agencies. These checklists will show you what gaps may exist in your organization as it relates to pediatric readiness efforts, and the toolkits will direct you to resources to help you fill in those gaps. And these two QR codes will take you to both of those toolkits and checklists. Next slide. All right, so how do we assess our baseline and begin improving this role? You've probably seen this process flow map in your focus area guide. So let's take a quick look at this and dive in. Where might you be in this process? So Meredith, if you could just click through as I go through this. So does your agency have a PEC? If not, identify the individual, it could be you, who has a passion to advocate for this role, even if that means adding additional duties to a current role. If you do have a position, but others aren't even aware it exists, consider a brief presentation at your next staff meeting to educate your coworkers on what you do and why it matters. If no pediatric specific training or expertise is required for the position, consider including national course requirements as part of your refresher training. Ensure that the position's roles and responsibilities are clearly defined and documented in a job description. If it's clear that your PEC doesn't have the necessary resources to affect change in your organization, briefly outline the needs and identify items that have a budgetary impact. If you've accomplished all of this but lack the appropriate mechanisms to implement changes, sit down with your leadership and determine how best to start implementing improvements. Next slide.
This is just a quick screenshot of the environmental scan. You may have already completed this. This is really a tool to help you identify what are your specific needs. If you have not completed this, please do so after watching this session. It'll help you level set and evaluate where you're at. If you have not completed this, you will receive emails just every Monday until this is complete. So the sooner you get it done, the less emails will fill your inbox. Next slide, please. So what we want to focus on is really picking one thing that you can do to improve that role of the PEC, or even creating that role. If you just want to tap through these, Meredith. Okay, so first, this is really our elevator pitch for your leadership or your senior people to really help advocate for this role, or even strengthen the role if you already have a PEC position. So what is the PEC? What does a PEC do? What makes that PEC or Pediatric Emergency Care Coordinator unique? What do you need as far as training to be successful? And how does this benefit patient care, patient safety, and quality improvement of your facility, whether it be a hospital or EMS agency? Okay, so this is really your elevator pitch. Next slide. When you think about what it will take to make an improvement, we want you to aim high, but the real focus is really starting small, especially if you've never done any process improvement. Understand where your department or entity is currently. How comfortable are you and your staff at recognizing and caring for pediatric patients in distress? Where do you want your department to be or your unit to be? Advocate for the role by gaining staff, provider, or leadership support. Start small. This could be one part of a process that you want to improve. This may seem like an overwhelming lift, but take your time and really, like we said, and we keep reinforcing, start small with one part of something that you want to improve. Next slide, please. When we talk about goal setting, we need to create a SMART aim. And this is really just a sentence that defines the change or improvement you want to make. You want to be specific. What do you want the outcome to be? Make sure it's simple and small. You want it to be measurable. Sometimes you want to get a baseline to see where you're at. Other times that's not necessary. What do you want the future state to be? Always make sure it's in a percentage, a rate, or a number. You want to make sure it's attainable. This isn't part of your aim statement, but you want to make sure it can be accomplished. Think about the how when you're talking about attainable. How will you get to where you want to be? And then you want it to be relevant and realistic. Is this achievable with the resources you have? You don't want to set yourself up for failure by creating a goal that is unrealistic with if you only have 2 nurses on a shift or something like that. or 2 paramedics on for your whole agency, and you have a lot of volunteers. And you want it to be time framed. Always start small with a 3 to 6 month time frame or even shorter. Next slide, please. Back one, please. These are just some examples of SMART AIM going through our process map. So you see all of them have a date that you want to meet. They all have either a 100%, so a percentage for the PECC and NPC class, so it's 1 class, or 3 is a number, or having 1 support person. Next slide. So now that you've created your aim or your goal, you need to build the team. Depending on the project, it may be a team of 1. It may just be you as the pediatric emergency care coordinator or champion, or you may need many to meet your goal. You really want to identify your key players, your manager or leadership, your team members that can support the PECC role, your quality or safety person if you have one, and then medical provider leadership. Next. Just click through those, yeah. Next slide. So when we talk about measurement, measurement is really how you're going to be able to show that you've made an improvement. You can't change what you can't measure. So you want to make sure whatever your outcome is, that it's measurable. Some is not a number and soon is not a time, which you saw when we showed our examples of our AIM statements. They all had a specific date. Even if you don't make that date and it has to be extended, it's still measurable and you still want to continue working towards that. You may need to adjust it as needed, or if things change, make adjustments. Measurement does not need to be complex. It doesn't need to include statistics. Next slide. We really want to focus on learning and not perfection. We talked several times, I think, about gaining leadership support and team buy-in. How will this improve your function or your workflow of your team? Be flexible. You may need to change things up, like I said, as you go. Think about steps that are going to be necessary to make that change. Always start small, 1 item or 1 part of a process. Learning will be incremental improvement. This process is like a baby learning to walk. If at first you don't succeed, get back up and try again. Next slide. We have an array of resources for you in your Focus Area 1 packet. This QR code right here that's attached will take you right to those resources. So in conclusion, if you always do what you've always done, you're going to get what you've always got. This is a quote from Henry Ford. Next slide. Just some housekeeping and reminders. Your CE credit, you will be emailed a link to the session evaluation. You must complete this to receive credit, and this is for the live sessions. Complete the online version of the focus area. Email Meredith if you need your link. Automatic reminders, like I said, go out every Monday. Our next learning session will be October 7th at 1 o'clock Eastern. This will be on patient safety and family-centered care. And if you have any questions throughout any parts of this program, please email us at pwdc@emscimprovement.center. Thank you.
Thank you, Rachel. Thank you, Michelle. Wonderful presentation. Thank you all for taking the time to watch this recording. We hope we found it useful. As Michelle said, email us at pwdc@emscimprovement with any questions. Thank you.
Thank you.
Thank you.